Hi, everybody. This is Dr. Narda Robinson, founder and CEO of CuraCore Vet and CuraCore Med. Thanks for being here today for our Facebook Live presentation on rogue rhomboids. Do you remember when rhomboids were covered in veterinary school? Do you remember dissecting them or building them with clay? Do you remember finding them in your patients? Maybe not to any of those. So that's why we're going to review the rogue rhomboids, because this is a vital part of your physical examination when you're evaluating dogs, cats, horses, anybody. Now, there are differences between the rhomboid conformations and parts that we'll cover between carnivores and other animals like horses and rabbits. So we'll get started by talking about whether you have had rhomboid problems in the past. Have you ever had where medial to your scapula, there's a trigger point and it just, I know when I get that, sometimes it's like, I just want to tell a massage therapist, remove that muscle because it's so painful and it's very particular. It's just medial to the scapula, usually on the right. And well, at least with me, with right hand dominant. And so close to the scapula, but it can resolve. And part of that is when your posture isn't good. So make sure you've straightened up as well. But so who gets these problems? Well, anybody with rhomboids, because the rhomboid muscles help to attach the scapula to the body wall. So let's look at our skeletons. So this is a reproduction dog skeleton, and the little bit of anatomical, like not exactly right, just how it was put together, but it's okay and it works well with the clay. And then this is my little dog for showing palpation. And so what the rhomboids are doing, so who gets them? Everybody. What are the rhomboids? The rhomboids are these muscles that attach from the medial border of the scapula over to the spinous processes. And so that's the thoracic part. Now, with humans, let's say this was a human on all fours for some reason. So in us, we have rhomboideus major, which is lower, and then rhomboideus minor is on top of that. And they act as two separate muscles. And so there's just two parts to them. And so you can still get the problems, but they will attach only up to the thoracic spinous processes. So note here in this dog model that we have a thoracic part, a cervical part, and then this capitis part, which is very significant. And again, if we didn't have muscular attachments that went from the scapulae to the body wall somewhere, then we wouldn't have a way to attach the thoracic limbs. So a lot of this is due to synsarcoses, so SYN sarcoses, so just where the muscles and the fascia are keeping things together here. And so who, what, when do rhomboids go rogue? Well, that can be because of overuse. It can happen just because, let's think of dogs, how they're being led around, maybe from a leash or a harness, or their person is riding a bicycle, something I don't like, dragging their dog behind them, and the dog is overusing their thoracic limbs trying to catch up and keep up. So I don't recommend that at all. Another reason that rhomboids could go rogue, and by rogue, I mean get shortened. And when muscles get shortened, they can get uncomfortable. They can develop trigger point pathology or taut bands. And that's a type of myofascial dysfunction that can cause a lot of pain. It can cause aberrancies in motor movement and chronic contraction, so that when muscles are chronically contracted, they lose power because they're already shortened, so they can't shorten all that much more. And then it's just uncomfortable. But the thing here's my sample human for the moment, the thing different, again, between humans and these cats and dogs is that we don't have a rhomboideus capitis that goes up to our head. So all of the muscles attach, for the rhomboids group, they attach to the medial border of the scapula. And so this is the thoracis, and then they attach onto the spinous processes. Here's the cervicis, which goes up from the medial border of the scapula all the way up to the spinous processes of some of these cervical vertebrae, but also the dorsal raphe of the neck. So I'm not showing that here. But then the capitis, present in carnivores, not that humans are necessarily carnivores, but some of you are, and they attach from the medial border of the scapula up to the occiput. And so I have a question for you. Do you ever see, if you have a cat, maybe a dog does it too, but cats do it super frequently. So this is now a cat. And they, let's go back here. So let's say you have a cat and they're on the counter or they're on a chair or something, and then they jump down and they shake their neck. Why do you think they shake their neck? It's not just that they do it because of no reason. They do that because I'm assuming, based on the anatomy and physiology of what's going on, that when they jump down, that they are impacting, they're jamming their neck. So think of if this was a cat, then they would be landing on their thoracic limbs, on their paws, and there'd be this whole reverberation of the landing impact. And what fascia does, along with the muscles, is it's dispersing the forces that are generated from that impact. But here, when we have a cat or dog, that impact is also coming up to the neck muscles, to the dorsal raphe, which also attaches up with the nuchal ligament up to the occiput, or to the occiput here with the rhomboideus capitis, the rhomboid of the head. And so when they shake, they're helping to activate mechanoreceptors, which are analgesic, and then, just kind of shake loose that muscle and fascia and provide some pain control, because that is just a big impact. And I think that there are other muscles as well that get it. But once you see the anatomy and function of the rhomboids, I think they are quite implicated. And rhomboid is a shape like a diamond, and like a kite or a diamond. And with the human, again, this is back to a human would, each side would be like this and like that. So it'd be sort of just offset angled. It's not really a rectangle, but it's one on angle. But with these guys, it's a different kind of diamond or rhomboid. So it loses that kind of close together architecture. But I do like to use the mnemonic that the diamond is below the trap door, which is the trapezius. So the trapezius will be superficial to the rhomboids, which means that if you're going to try to palpate these in one of these species, particularly the dogs or cats, remember that palpation, we're going to use cross fiber palpation. We're not going to go longitudinally because you're not going to feel much of anything. So now this is a dog or a cat. And if I'm going to palpate the rhomboideus capitis, then I'm going to come cross fiber like this, and you will feel that. I'm going to just move this guy over here a little bit. And so when you're doing your myofascial palpation as instructed in our acupuncture course, in our rehab course, or in our massage course, we're coming down here and whole hand palpation, cross fiber. So what you will do is you will feel these ropey bands coming this way. And if they are fairly head shy because they have super tight rhomboids, or just their whole neck is a problem, you will get to that border and you will feel that rhomboideus capitis. Another thing to note is that oftentimes when we're doing our palpation, that the most tender areas are where the attachment sites are. So we have on the occiput here, and I don't like the pokey fingers, but I could see if you wanted to assess the attachment here, then that would be one thing. Then there would be the mid-belly here, like we see here. And then the attachment sites for all the rhomboids is that inner border of the scapula. So you can know that already. And then just with your hand, you can come and assess these. And this is going to be pretty tender, especially if you have a cat. they're gonna let you know. And again, don't cause any pain or real resentment among them, but that's where we're going to pick up subtle signs and appreciate what they're telling us through their body language. Through dogs will lick their lips or yawn or look away or give you side eye, different things. So that's the first thing. Rhomboideus capitis is here. And then rhomboideus cervicis is coming up here. So again, from the medial border of the scapula up to the cervical spinous processes and the connective tissue that comes along the dorsal midline. So we're going to, what we can do is feel in through here. There's going to be a bundle of tissue, especially with dogs, right in through here anyways. And with our clay anatomy courses, that's what we build, is all those muscles that attach to the underside of the occiput there, because there's a ton of them. But you can get an appreciation for that rhomboideus cervicis working in there. So again, the diamond is below the trap door. So the trapezius is what you will be feeling first. So in these cases, you do have to sink in a little bit more to appreciate where the rhomboid is. But when you get there, you will know it. And then the interesting thing is also the rhomboideus thoracis. So if this is the medial border of the scapula, like you see here, these fibers are coming this way because they only have to go from the medial border of the scapula over to the spinous process. And so this is another good diagnostic indicator, is that how many fingers can you fit through there? If they've got really tight scapulae like this, you can maybe sometimes fit one finger there, maybe between both of them, or sometimes no fingers if they're super tight. And that, because you know the architecture now, that will tell you how congested they are in that region. And that's really informative, because if all these muscles are shortened, which probably they'd all be shortened, but especially if certain ones are, then you're going to differentially notice that with your palpation, because you will be able to feel how tight those areas are. And then you reflect back on your how to see a dog approach, because like you think, well, why is this guy walking with these short little steps in the front? Okay, well, it could be anything. Could be many people would say, oh, there must be elbow arthritis or shoulder something or other. Well, it could be anything. It could be a cervical lesion, but also could be that the rhomboids are super tight in here, and so the scapulae can't move. And so that's why also you should be assessing these, because they are part of your differential diagnosis when there's loss of forelimb strength or stride, or just the neck is ventroflexed. That's often a problem with our dogs, is that we see, let me go back to the other camera here. So when we're doing the how to see a dog approach, that's where we're watching them with standing or with movement from nose to tail and top line to toe. And we want to see, is there a ventroflexed neck? And if there is, then we say, well, why is that? Are there muscles pulling from the ventral aspect? Does it hurt to extend your neck? Are there neurological compressions? All kinds of things. Is there weakness? But that's why when you are examining your patients, you'll find that out. But we can't assume that it's one thing or the other until we examine them and actually know. So finally, so what do we do about it if we find them? Well, for those of you that do acupuncture, what's between the two shoulder blades? Now, with this model, here are the scapular borders, and you'd almost never find this much room in between the scapulae. It's just, this is how this model was recreated. But if we say this is more normal and through here, then remember that bladder 13, 14, and 15 are between the medial borders of the scapulae. And so we're already doing those with our acupuncture points. Think about GV14 at the cervicothoracic junction. These aren't your normal acupuncture pins. There we go. So GV14, where are we with that? So here, should go in easier here. So bladder 13 level with the caudal border of the spinous process of T3, and bladder 14 level with the caudal border of the spinous process of T4, between the longissimus and iliocostalis muscles, good. And bladder 15, no color coding is intended right now, and so we would have that on both sides. And then GV14 at the cervical thoracic junction, well, there'd certainly be some soft tissue in that region. We'll just needle here just for kicks. So GV14, bladder 13, bladder 14, bladder 15. Now, what points would be here at the attachment of the rhomboideus capitis? Let's see if we can get them in here. Yep. You needed this, didn't you, sweetie? Okay, there you go. Eating a lot of tacos lately, huh? Okay, so there'd be other muscles going on here, but yes, GB20, gallbladder 20, could be in this area. And so acupuncture is certainly one approach that we could use to help relax the muscles that we find tight. We could also use some local needling along the belly of the muscle, which I see a lot of people do. And that's because you've palpated and you felt that there was muscle tension, but you didn't know what that muscle was. And now you do. Rhomboideus capitis. And then freeing up all this region in through here. And of course, we don't want to just locally do needling, because remember, we have our whole spinalis group, their erector or epaxial or erector spinae, and they go from the occiput to the sacrum. So we want to have whole body treatment, whole body assessment, and reduction of strain patterns all over. Maybe some lifestyle adjustments, some stretching, some massage. So I would do acupuncture for local restrictions where needed. Then I would do massage, and then I would follow up with laser. Typically a class 4 laser that I use so that it doesn't overheat, and I don't follow the preset parameters, but all of you that have taken classes by me know that. So just in summary, why do rhomboids go rogue? In a way, it's not their fault. It's what's going on. The rhomboids are really important, but are they being stretched too much? Are they being overused? Finally, the other aspect is, what about the pectoral muscles? The transverse pectoral muscle here and the deep pectoral muscles down here that all attach to the, put on the other camera. So you have the descending pectorals and transverse, but you have a huge deep pectoral muscle here that attaches to the whole sternum and then comes up into the greater tuberosity of the humerus. And so they get really tight in here. So if they're super tight in their pectorals, their arms, their thoracic limbs are being brought down. So there's going to be potentially a resultant dysfunction in the rhomboid. So whenever we're treating rhomboids, we want to also treat and assess pectorals and all the other muscles, the muscles on the sides as well, omotransversarius, brachiocephalicus. Those are muscles for further Facebook Lives. So I don't see any questions or comments, but feel free to write to us, and the email address will be in the notes for this video. And thank you for being here, and thank you guys for helping out. Okay, till next time. Thank you.